Good evening and welcome to Thai PBS World. A COVID-19 Center Situation Administration or CCSA has a meeting today and the center approved special tourist visa to draw foreign visitors to help ailing economy, especially in tourism industry. And what's the assessment of medical personnel who has been working very hard to cope with COVID-19? Thai PBS World Tonight, Kun Thep Chayong and I talk to Dr. Thanarak Phalitpat, Deputy Director General of Disease Control Department. The CCSA press conference today, Dr. Thuvisin mentioned that we have 10 provinces connected with the Myanmar side. So what should be the strict measure in order to contain infection that may come from Myanmar?
What we should do is take instead of relying ourselves upon the policemen or the soldiers who patrol the borders, I think everybody should join hand in hand in trying to solve this problem. Migrant health volunteers is also one of the components of the health system that we design in order for us to help detect abnormalities of the situation in the migrant workers. So at the moment, if everybody's work together, health sectors, the police sectors, the government sectors, private sectors, and also the American health volunteers, then I think everything should be fine. But it needs the whole government and whole society approach in order to slow down or to solve the problem.
There have been suggestions that Thailand may want to consider sending medical personnel or medical facilities to help our friends in Myanmar to cope with the pandemics. You think that is a possibility?
That is actually the strategy everybody considers, but that's really depending on the government talking between the Thai government and the Myanmar government.
And what about the extension or granting special tourist visa to Thailand? Dr. Thanarak, do you see that it's the right timing to have more foreign visitors? And what should the local do more in order to cope with the COVID-19 pandemic?
We all know that about 15% of our GDP is with the tourist industry. So the decision of CCSA to open up or to try to encourage the tourism by encourage the travel into the countries, but still with a very safe approach. I would say that any tourist who come in need to have 14 days quarantine. That is the safest approach we can do. And in trying to encourage or trying to stimulate the tourist industry at this time, I think is the right things to do. With starting from the lowest risk approach, then probably if it's work, we may consider other strategies. Again, the other strategy is also a safe one, but we may need to do it in order to stimulate or to encourage the tourists from other countries to travel to Thailand.
With this kind of international efforts, how optimistic are you in seeing a COVID-19 vaccine available in the very near future?
What we know is that by the end of this year, several companies are very positive that they are going to get the result of the vaccine. But we have to understand that the phase 3 vaccine has just started a few months ago. So if by this year we get the result of the vaccine, it means that it should be what we call the just 6-month effectiveness result. What we know so far is that the US FDA has announced that if any vaccine has about 50% effectiveness in 6 months, they are going to approve those vaccines. That's also said that the vaccine has to be safe. So in the end, well, they are going to approve the vaccine, but in the end, we have to wait and see how long the vaccine has a protection for the COVID-19. What we would like to see is the effectiveness at 1 year, not just 6 months.
And Dr. Thanarak, in terms of figures from COVID-19 is quite alarming because as of now, the total number of infection around the world is 33 million. And the number of death cases is more than 1 million already. In your view, how alarming this is? And in Thailand, we talk a lot about probably second wave or third wave. What's your take?
Okay. I believe that the number of both cases and death that report in the news today or in the media today is under report. As we all know, so for example, one of the studies from the US that's doing the testing of how many people get infected, we know that a lot of people was not reported into the system. Some state the underreport is more than 10 times. If we are not doing anything to slow down the epidemics, we can expect that there can be more than 100 million people around the world get infected this year. And as I mentioned, 30 million is a lot underreport. And if we say that the numbers that is reporting to the system is 3 times less, it means that probably we should have more than 100 million people get infected up to today. And now about the second wave. It doesn't mean that every country will face the second wave, and it doesn't mean that the second waves will always be bigger than the first one. We have seen what happened in Vietnam, and we have seen what happened in New Zealand. Both of these countries is the countries that has controlled the epidemic very well. If we look at these two countries, we can say that the second wave can come, but if we take appropriate measures, we can control epidemics. And in New Zealand, the second wave is not that large at all. In Vietnam, it takes them just a few weeks for them to control the epidemics. So it is not the nature of the disease that it have the second wave. It is our behaviors. It is what we do. It is not about the disease itself. If we have a new infection occur in the country, it is not necessary that we are going to have the second wave. And if we have the second wave, it is not necessary that we are going to have a bigger problem when compared to the first one. So all in all, it is what we do. It is what the Thai societies will do in order to limit the spread of the disease. It is not just about the disease itself.
And that's all from Thai PBS World tonight. Thank you very much for watching.